Hello and welcome. UVA Speaks is a podcast of Lifetime Learning, a division of the Office of Engagement at the University of Virginia. Lifetime Learning brings the knowledge and expertise of UVA's faculty to the university's alumni, friends, and families. My name is Susan Lynch, and I am the Associate Director of Lifetime Learning at the University of Virginia's Office of Engagement. This podcast features Kristen Roorbach, a psychotherapist and educational psychologist who's a lecturer at the Batten School of Leadership and Public Policy at the University of Virginia. As a clinician, Roorbach works with children ages 3 to 18, families, and individuals using brain-based and solution-focused methods to support them through issues related to anxiety, stress, trauma, depression, and challenging behavior. At the Batten School, Roorbach teaches a class entitled Trauma and the U.S. Public School System. In this podcast, Professor Roorbach will talk with us about the class and how her clinical practice informs her teaching. So thank you so much, Professor, for speaking with me today.
Yes, thank you for having me.
Great. So first, can you tell us a bit more about your background and your clinical practice?
Sure. My background is quite a windy road, and I feel very lucky to be on it still. I actually went to the University of Virginia undergrad, and when I was there, was very determined to be a lawyer. I was pre-law. I graduated. I went to work for an environmental litigation part of an insurance company and thought I was going to be a lawyer, and I just really didn't like it. And so I actually ended up quitting my job and becoming a preschool teacher. And I remember after the first week that my cheeks hurt because I was so happy. I smiled so much. I loved what I was doing. And it turns out that I wasn't a very effective teacher, or at least safe, because I got a concussion and a black eye. I was working with children who had developmental disabilities in an integrated preschool setting. And that was so intriguing to me. And I really kind of got interested in special education and developmental progress and both ability and disability. So I ended up going back to get a master's in early childhood special ed. And while I was there, I found that that wasn't going to answer all my questions. So while I was student teaching and kind of trying to figure out what I wanted to be when I grew up, I started doing research with a professor in early childhood development and behavior specifically. And I ended up staying for a PhD in educational psychology. And that was one of the most interesting and intriguing parts of my educational past, because I was also pregnant at the time. And so my daughter will laugh about the stories, because when she was born, I was doing all of my experiments on her. And it was really an incredible time to be pregnant and learning about development in the brain. But I ended up teaching. So I was doing some research at the University of Virginia when I graduated. I got a visiting professorship at the University of Richmond, and I was there for 2 years teaching in the psychology department, which was fascinating. It was an undergrad teaching job. It was totally different than anything I'd ever done. And I fell in love with teaching, with the teaching part all over again. And when I kind of was in the classroom, I was thinking about all of the kids who are in K through 12 educational experiences that have teachers that didn't have access to the psychological knowledge that we were kind of talking about and unpacking in my undergrad classes. And I started doing some consulting with school systems. And I ended up getting very involved in research and practice about what stress and trauma does to the brain, and how stress and trauma impacts learning in such a significant way that we don't really have a script for or understand in the traditional K through 12 educational model. And so I ended up actually starting my own private practice, which was consulting with public school systems about that and teaching in adjunct settings back at the University of Virginia.
Okay, great. Thank you. As I mentioned, you teach a course at the Batten School entitled Trauma and the U.S. Public School System. Can you give us an historical context of education and how that impacts today's educators and students?
Yes, I can try very hard to give you a brief historical context. This is a big question. I think that what's interesting and what a lot of educators don't really know or understand is that the United States public education system started to create social competence in the citizens of America. And at the time, of course, it was a very specific and small subset of culture in the United States. The kind of, well, not small, I guess the majority. It was very white. It was very male, and social competence was basically defined as giving back to the economy and being able to have a job and pay taxes. And so if we look at the entire United States public education system through the lens of how they defined social competence originally, it really begins to unpack a little bit about why mental health and education haven't historically played nice. And I talk with my students all the time about the opportunity gap. That's really the primary focus of my work, both clinically, when I work with families and children in my office in a psychotherapeutic setting, and also in the educational setting, is that we have very large gaps in the United States in opportunity, in what children specifically are able to access, whether it be um, an actual resource, so books, clothing, housing, or experience. And that's really the key part of my class and what I talk to my students about is that when we talk about an opportunity gap, we're also talking about social experience, the ability to have access to back and forth conversation with a primary caregiver or having their cues read significantly, meaningfully, and consistently. And lack of opportunity that has to do with social experience is largely not a part at all of the United States public education system. Um, the K through 12 model is very academic. It's focused on math, reading, science. There are definitely, music and PE things thrown in there, but it is really lacking in specific social skill development. And so that's the quick and dirty historical context of the United States education system, and it really impacts students and educators in a way that the more we understand about educating the whole student, a whole person, which includes social and emotional development, we're asking teachers, we're asking educators to do something that they haven't really been assigned to do.
And it seems that so many systems are now you're teaching to a test, these standardized tests through the states. And, that brings it a whole nother level, I think, I'm sure, of complexity for educators and students alike.
True. And actually, the exciting news is that I do believe that through research and through our outcomes in practice, we are moving policy a little bit away from the standardized assessment, which is really beautiful to see. We are incorporating more kind of holistic child approaches to how we determine success. It's a very slow process, but ESSA, the new education policy, well, new that it was enacted in 2015, really allowed that to emerge.
Good. Good. I'm glad to hear that. This course description mentions that you address the neurobiology of trauma and stress and the effects of trauma on learning. Can you explain this a little bit more?
Yes, again, the whole class is this, so I'm going to try and do it briefly. But there's a two-pronged answer to this. One that involves neurological change, so at the single brain level, and even more specifically the neurological level. There is a lot of neurological growth, obviously, that occurs from the age of birth to 5, before we get them in our traditional K through 12 education setting. And that neurological growth creates myriad pathways and learning opportunities, or differences in learning opportunities, that then we accept kindergartners in the front door with kind of anticipating and expecting that they all have what we think that they should have. And that becomes a really tricky wicket. So neural change in the birth to 5 area is fast and furious. It happens at an incredible speed. I don't have the time nor bandwidth to articulate how incredible it is during that time. And then as neural pruning happens around the age of 5, we kind of start locking into our neurological ruts, what we've learned, what becomes muscle memory. And if a child has, in that birth to 5 period of time, learned, let's say, turn taking through babbling. So when I babble, a parent will babble back at me and then stop. And that's how I know that I can go and babble more. That actually is the roots of turn taking, which is the primary focus of kindergarten, is teaching kids how to take turns. And those basic kind of pre-educational skills. And so if a child has come in with a neurological set of ruts that are specifically honed to take turns and to communicate by vocal interaction, that child has a great advantage over a child who hasn't necessarily had exposure to that in terms of neurological development. And the beautiful thing about the human brain is that neurological pathway can be built in school. So at 5, 6, 7, 8, 9, we as teachers or as educators have the opportunity to teach a child these brand new neurological pathways. But the problem is that then would take away from the tasks that educators are tasked with doing in the traditional K through 12 education model. And so you end up having a large gap in availability of neural function, or not function, because functioning happens, but really the type of neurological pathway that has been created. And teachers have to kind of build up new pathways for things that other children come in already having.
Right. And as the question also, some kids come in with a different type of trauma and a different type of stress within their family systems. And they're in the same classroom as other kids. And that's such a complex thing to ask.
So there's a second part of this, if you
right.
That is the idea of epigenetics. And that is a way zoomed out focus of neurological development, neurobiology of trauma, because as I was talking about the pre-educational skills that may be taught when a child is exposed to trauma, especially in early childhood or at any point in their development, the neurological pathways that are formed are largely protective. They're largely informative about what kind of touch is safe and what is not. And for example, if a child has exposure, lives in an environment where there is domestic violence or a very loud and angry yelling environment, then that child learns that voices or that anger is bad. And that's a really tough message for a child to come into a K through 12 education setting with, because anger is a human emotion. We can't help that. We have to feel angry because our brains are designed for that, and we cannot control the feeling. What we can control is how we emote, right? How we regulate our emotions and how we put it out there or handle our anger. And so if a child has the neurological rut of that person is angry and now I need to hide, or that person is angry and now I need to defend myself, that can look really not like a traditional education setting where the teacher might have a raised voice but not be angry in the same way that child is expecting.
Yeah.
The epigenetics part of that is that We are largely we have access to a huge amount of children, a huge amount of the time. It is by law necessary for children to show up at school. And so we have access to so many young minds whose brains are malleable, who we can introduce these positive neural routes, right? So teaching a child that a voice can be safe, teaching a child that you can be angry. You can't hit me. You can't kick me, but you can feel anger. That is okay in here. Teaching them those things actually has a neurological impact that then changes genetic code, which means we're not only educating that child at the neurological level, we're also informing potentially future generations, which is mind blowing to me.
That really is interesting. Interesting. Yeah, as you say, I mean, you're teaching an entire course on this, so we are asking you to distill this information down. So again, I'm going to ask you another pretty big question. So, can you explain how, sort of school-based mental health services or educational support services fit into today's school system?
Sure. So, let me take a breath. I said earlier that that traditionally mental health and education don't really play nicely, and it's by design. The historical context of education was not to necessarily create a whole child, and we have really in the United States these kind of cultural manifestations of what we understand as health and who is responsible for health in general, not just mental health. And largely in the United States, health is the responsibility of parents for children. And so when a child comes into a school setting with when children come into a school system with variable mental health outcomes or mental health needs, that the parent may, one, be either addressing or not, or two, have their own mental health needs that they are attempting to address or not, it becomes the responsibility of the school setting in the fact that what happens from mental health is behavior. And if we as teachers are having to align or shift behavior, then that goes above and beyond what we've asked traditional education teachers to do. So there has been lately, and with the introduction of the Every Student Succeeds Act, ESSA policy that was enacted in 2015, we really have opened the door for the presence of mental health awareness, the presence of social skills support in public education settings more than it's ever been there before. And that's been really beautiful to watch. I think the fact that some schools have actually public or mental health centers within a school, there are increased numbers of counselors per student. There are now ways at the policy level that we are introducing an understanding of mental health as a focus to establish learning. And that's really been wonderful to watch. Unfortunately, the ideas haven't really been supported or followed up with funding, as also often happens in the policy world. And so the practice of mental health in schools and the understanding of social skills development has not really been enacted. One of the other big factors influencing this, and this is a cultural wave. So culture comes in waves and informs the way we understand big topics, right? Like education and health and mental health. And the idea of mental health and the existence of safety in the classroom. So the existence of behavior as a part of mental health, and then having to keep students safe in the classroom. Those two have unfortunately, through my lens, been viewed separately and almost against each other. So if a child is having traumatic reactive behaviors in the classroom that are violent, right, that are physical, that child both needs help, needs mental health help, but is also not safe. And unfortunately, there are systems and kind of understandings of policy that have disconnected the two, that have taken, like, for example, SROs have been removed, and then mental health practitioners put in place. The funding basically has been shifted, but there is no other model for safety. So the SROs, the police officers that were in the schools, are no longer there, but there has been no model to replace what they did for public safety. So how can we view mental health and safety as a yes and is really the big question that we need to tackle, that we're not doing a great job of right now.
Yeah. Yeah. It's a lot to ask teachers to do and systems to do, and also for the kids themselves. I mean, it's really tough.
Yeah.
So, and finally, again, another really big question that I'm going to ask you. You're teaching this course at the Batten School of Leadership and Public Policy, and you've mentioned public policy several times, but what is it that you hope that the students will take away from this course in terms of how they might apply the learning to public policy if they become, uh, if they're the ones writing the policy or things like that? What is it that you would like them to take away?
Yes, that's a great question. Well, first of all, I consider myself very lucky to be a part of Batten. I really do. Um, Batten, in a way, as a department, as a school, has expanded the view of of a professor of higher education in ways that I think are really, really incredible. There are practitioners who are part of the faculty. There are lots of opportunity for engagement in the community. And so I really consider myself, as a mental health practitioner, as a trauma therapist, to be teaching at the college level really wonderful. And one of the big goals that I have for the course actually is, because we're living in times that it's really kind of, it could feel not safe to talk about some of the issues that we're talking about in terms of trauma, and education and policy, because of political differences or because of the very real and terrifying outcomes of school violence that we have been hearing about lately. My goal, first and foremost, is to make this space in our classroom safe to discuss these very heated and emotional and triggering issues. So this very much is a policy class. It is not a politics class. And the way that I try to embody that is by modeling it. I have a lens. I am a professor. I have a lot of letters after my name. I grew up in a certain place. I look a certain way. I am a parent. I am all the things that kind of give me the lens that I have. That lens is not right. It's not wrong either. It's a lens. So as we come into my class, I very much encourage the students to bring their own lens and be aware of it
Mhm.
and call it out
Mhm.
and ask questions through their lens, and then understand and accept that other people have lenses also that might be different. So that's the first primary hope that I have for this class, is it becomes a safe place to talk about tricky things.
Mhm.
And the second is, I have been a practitioner. I have been a researcher. I have been on the Hill. I've been in policy. I have been an advocate. I have been all of these different places and roles. And I think, we hear all the time about silos in education, that I don't fit. And I love that I don't fit in one of those silos. And so the second primary goal of my class is to help my students understand that there is no successful policy or research practice or practice in teaching or in any other field that doesn't include the other two. That if we try to understand policy as a policymaker and not communicate with practitioners and don't read the research or seek out the research, we're really running without all the information. right? And we can't go very far. And so the three parts, research, policy, and practice, have to be incorporated and have to be understood as a flowing entity in order for us to have any movement in our nation or largely our world.
Great. Thank you. That is really important for everybody to think about, to take it out of the purely political lens and to really think about policy as, what is in, as you're saying, informed policy based on evidence and research and what is best for the people. So I really appreciate that. Thank you so much, Professor Roorbach. And I know I've asked you very broad questions, and it takes you an entire semester to really distill this information for the students. But I think this has really been very good, and I really appreciate it. And we then can all think about this in a more broad sense, in our own way, and then get more information for ourselves. So thank you so much. I really appreciate you sharing your knowledge and expertise with UVA's alumni, friends, and families.
Thank you, Susan. Thanks for having me.
Great. Thank you so much. And thank you for everyone for listening. For upcoming podcasts and other lifetime learning programming, recordings, and blogs, please visit our website at engagement.virginia.edu/learn. You can also find our podcasts on the Virginia Audio Collective, which is a network of UVA podcasts hosted by WTJU Radio and can be found at virginiaaudio.org. So thanks again, and we look forward to you taking part in future lifetime learning programs.